With every passing second, Guyana draws closer to its goal of vaccinating 80% of its population and achieving herd immunity against the dreaded coronavirus. 2 months into the vaccination drive, more than 6% of the population have been immunized, excluding children, pregnant mothers, and adults below the age of 40. In providing an update on the exercise on Friday, Minister of Health Dr. Frank Anthony highlighted that over the last 3 days, 4,500 persons have been vaccinated per day. The total number of persons inoculated to date is well over 50,000.
Which has been a big increase, because when we started out, we were doing probably about 2,000, then it went up to about 3,000. So now doing at least 4,500 a day is a big improvement. And we think that is going to increase as well.
100 vaccination sites, mobile and fixed, have been established across the country to offer Sinopharm Sputnik V and AstraZeneca vaccines to eligible Guyanese. The Sinopharm jab, which has an efficacy rate of 79%, is currently restricted for persons aged 40 to 59, while the AstraZeneca shots are being administered to persons aged 60 and above. Dr. Anthony further disclosed that the Sputnik V vaccine, since its arrival in the country 6 days ago, has been used to inoculate 2,500 persons. He said another consignment of the vaccine is expected to arrive next week. Apart from immunizing first-time recipients during this week, the Health Ministry has also been administering booster doses. Those who have received the first dose of the Sinopharm vaccine 28 days ago were given their second dose during this week.
About 60 persons who had received their first dose Sinopharm, now they're getting their second dose. So about 60 persons now have received their second dose of the Sinopharm. They'll have to wait maybe another 7 days after receiving the second dose to be considered to be fully immunized.
Since none of the vaccines offer complete protection against the virus, those persons who are fully vaccinated are being advised to maintain strict adherence to the COVID-19 precautionary measures, such as mask wearing, social distancing, and sanitizing. According to the Center for Disease Control and Prevention, a person is considered to be fully vaccinated 2 weeks after receiving their second dose. Fully vaccinated persons can still become infected with the virus. However, they will not experience severe symptoms or be hospitalized.
Generally, when somebody is infected, if they remain asymptomatic or mildly symptomatic, it would take 10 days or so for them to be considered as having recovered. In other cases, people might become infected. They would exhibit maybe moderate symptoms, and those symptoms can persist for up to 28 days. So it all depends. So if someone has that type of experience, it's better for them to consult with their physician so that they can be properly advised.
If a person tests positive after receiving their first dose of a COVID-19 vaccine, the rate of their recovery could influence whether or not they will be administered a booster dose. Temika Rodney reporting for the HGP Nightly News.